1. Acute kidney injury. AKI. Top 3 causes. AKI is one of the most tested renal topics. Always think of the 3 categories: pre-renal, dehydration, shock, heart failure. Intrinsic renal. Acute tubular necrosis, glomerulonephritis. Post-renal. Obstruction from prostate enlargement, stones, or tumors. UKMLA clue. Pre-renal AKI, right pointing arrow, high urea, creatinine ratio, low urine sodium. ATN, right pointing arrow, muddy brown casts. Post-renal, right pointing arrow, hydronephrosis on ultrasound. Always remember, correcting the underlying cause early can reverse AKI. 2. Chronic kidney disease, CKD, staging and management. CKD is staged by EGFR, with stage 3 onward becoming clinically significant. Key complications: anemia, bone disease, metabolic acidosis, hyperkalemia. Management principles include ACE inhibitors to slow progression, statins for cardiovascular protection, EPO for anemia, vitamin D analogues for renal bone disease. Exam clue: diabetic patient plus albuminuria, right pointing arrow, start ACE inhibitor even if BP is normal. 3. Glomerulonephritis patterns. The UKMLA loves questions on glomerulonephritis. Know these classic patterns: nephrotic syndrome, right pointing arrow, heavy proteinuria, edema, hypoalbuminemia. Causes: minimal change, children, membranous, FSGS. Nephritic syndrome, right pointing arrow, hematuria, hypertension, mild proteinuria. Causes: post-strep GN, eager nephropathy, rapidly progressive GN. Clues they love: cola-colored urine, right pointing arrow, nephritic. Periorbital edema and frothy urine, right pointing arrow, nephrotic. Young man with hematuria after a cold, right pointing arrow, eager nephropathy. 4. Electrolyte emergencies, hyperkalemia and hyponatremia. Electrolyte disturbances are a favorite in UKMLA emergency-style questions. Hyperkalemia, red flags, muscle weakness, peaked T waves. Immediate treatment: 1. Calcium gluconate, stabilizes heart. 2. Insulin plus dextrose, shifts K plus into cells. 3. Salbutamol nebulizers. 4. Dialysis for severe cases. Hyponatremia. Key step: determine volume status. Hypovolemic, right pointing arrow, give fluids. Euvolemic, right pointing arrow, think SIADH. Hypovolemic, right pointing arrow, heart failure, cirrhosis. Exam clue: slow correction to avoid central pontine myelinolysis. SIADH equals low serum osmolality plus high urine osmolality. 5. Renal stones, types and management. 35 seconds. Renal stones are common in exams. Most are calcium oxalate stones. Classic presentation: severe loin to groin pain. Hematuria, restless patient, can't stay still. Imaging: CTKUB first line. Management depends on size. Less than 5 mm, right pointing arrow, likely to pass. Give fluids plus analgesia. Greater than 7 mm, right pointing arrow, lithotripsy or urology referral. Exam clue: recurrent UTIs plus staghorn calculi equals struvite stones. 6. Dialysis, when to start and what to know. You don't need to be a nephrologist, but you must know indications. Use the AEIOOU mnemonic: acidosis, severe, electrolyte imbalance, refractory hyperkalemia, ingestion, toxic alcohols, lithium, overload, pulmonary edema not responding, uremia, encephalopathy, pericarditis. Also know, peritoneal dialysis is gentler but slower. Hemodialysis is faster but less convenient.